Mrs. Smith has been married for 10 years, and during all of those years she remembers being sick all of the time. According to her husband, she constantly takes medications for all of her ailments. She's visited numerous physicians and none have been able to correctly diagnose her condition. Today she presents in your office complaining of shortness of breath, chest pain, abdominal pain, back pain, double vision, and difficulty walking due to weakness in her legs. As you can imagine, Mrs. Smith, no matter how many tests get done, these tests always come back negative. But the hallmark of her disorder is that she has multiple symptoms affecting multiple organs, and that is what's essential of the somatization disorder. So these are disorders typically seen in women, usually young women, and it's inversely related to their socioeconomic status. There might be some genetic loading, and an interesting feature has been that the relatives who are male of women who have this disorder tend to have the antisocial personality disorder, whereas the female relatives tend to be diagnosed with the histrionic personality disorder. Now, the presenting features of this disorder is many physical symptoms affecting many organs. There's no medical explanations. These individuals have long, complicated medical histories, and because of all these constant complaints, you know that it has to affect their personal lives. And the way to make the diagnosis is that you need to have 8 or more symptoms, and that is 4 pain, 2 GI, 1 sexual, and 1 pseudo-neurological. These individuals will basically seek out treatment anytime they can, and they usually have other disorders. For example, because of their symptoms, they probably abuse drugs. Because of their symptoms, they probably have depression. They probably have some underlying personality disorders or other anxiety disorders as well. The way to treat these patients is not to send them to different kinds of specialists or anything like that. You need to have a primary care physician handle the patient. So one identified treater is the treatment of choice. Always see them on a regular basis, because even though you don't find anything now, who's to say that 1 month, 2 months, 6 months, 1 year from now, you will not find some other kind of real disorder. So monthly, brief visits is usually the correct answer. And slowly you try to have the patient understand what is going on and get them to have some sense of awareness as to where these symptoms are coming from. As far as the medical differentials, there are numerous things that you must consider and always rule out before you finally say that the patient has somatization disorder. This includes myasthenia gravis, lupus, it could be AIDS, it could be infections, it could be anything like multiple sclerosis, thyroid disease. From a psychiatric point of view, it could be due to depression, it could be substances, or it could be just pure anxiety disorders, which are triggering these somatic complaints.